Hello everyone, welcome to the channel. In today's video, we are exploring the anatomy of the sternum, the bone that forms the anterior wall of the thoracic cage. Today we will explore the anatomy of the sternum. The sternum is a flat, elongated bone that forms the middle of the anterior part of the thoracic cage. It has three parts designated as 1. The manubrium, 2. The body, and 3. The xiphoid process. These are the three parts of the sternum. The manubrium. The manubrium is roughly trapezoidal bone and the widest and thickest of the three parts. The concave center of the superior border of the manubrium is the jugular notch or the suprasternal notch. The clavicular notch is a shallow depression on the either sides of the superior lateral margins of the manubrium. Body of sternum. The elongated part of the sternum is called the body of the sternum. It is located at the level of T5 to T9 thoracic vertebrae. The manubrium and the body meet to form the manubriosternal joint. Their junction form a projecting angle called sternal angle or angle of Lewis. Angle of Lewis is a useful point to start counting the ribs. It is a site where special events occur. Here are some events that occur at the sternal angle or angle of Lewis. You have the beginning and end of the aortic arc. The bifurcation of the trachea occurs there. The bifurcation of the pulmonary trunk takes place there. Left recurrent laryngeal artery loops under the arc of aorta at that level. Azygous vein drains into the superior vena cava. The thoracic duct empties into the subclavian vein at the sternal angle. The xiphoid process. The xiphoid process is the smallest part of the sternum. It is thin, elongated, and lies at the level of L1 vertebra. It may be pointed, blunt, bifid, curved, or deflected to one side anteriorly. Let's look at the clinical anatomy of the sternum. Sternal fractures are usually not common, although crush injuries can occur after traumatic compression of the thoracic wall. In automobile accidents, the most common site for sternal fracture is the sternal angle or the angle of Lewis. The fracture of the sternal body is usually into several pieces. Sternal injuries could result into heart issues or pulmonary injuries.